are watching is a chapter out of my book, The Normies Guide to the Theory of Nothing. Now you do not need to watch the rest of these chapters in order to enjoy this chapter. This chapter is good all on its own. So if you like this chapter as a nice sample of the book, you can watch the rest of the book in order from the beginning, if you enjoy. Namaste, mother duckers. Chapter 19, The Placebo Effect. If you have an illness, go see a physician. If even the doctor gives up, and you're still conscious, for the small fee of a day's wages at your most recent job, I can cure you at least 30% of the time. If for any reason you don't get cured as a result of my particular brand of quackery, here at Zilch ZILCH, Magic and Woo Incorporated, I will provide a 100% payment back guarantee to you or your loved ones. A 7-day minimum waiting period with the proof of payment received must be provided for a refund. Reasonable proof of failure must also be provided to receive back the payment. Other terms and conditions may apply. Hi, I am not a doctor, but you can call me Not a Dr. Snavely. I hold a doctorate in nothing, as you can see right here, and yes, the nada is part of the title for legal and good faith reasons. As you can see by my white lab coat and intentionally placed stethoscope straddling my neck, I am truly a real doctor of nothing. Zilch holds the cure for you at a 30% frequency without my help, but by my special guidance and knowledge of the universe, together we will unlock the mysterious power of miraculous healing that is currently trapped inside your own brain. I have a hypothesis for the ears of the audience. I believe there is somebody here who has been dealing with pain in their lower back. Is there anybody here who fits that description of having chronic pain in their lower back? A 50-something-year-old woman stands up near the front of the audience. That's me, Dr. Snavely. I've been having pain in my lower back for 3 months now. Nada, Dr. Snavely, but yes, I see. My hypothesis of the future was correct, yet again. Come up to the stage, child of Zilch and Nada. The hopeful eyes of relief come attached with this woman as she ascends the stairs to the stage to accompany Nada Dr. Snavely. She, being aware of the theory of nothing, knows full well of the powers of the placebo effect. And being aware of the placebo effect does not reduce the frequency of its rate of success. Only the belief or lack of belief in the treatment holds a noticeable impact. So this woman is well on her way to be part of the 30% success stories. She holds the belief that Nada Dr. Snavely has the means to cure her of her ailment. Alright, let's first try to cross our T's and dot our I's to keep up to snuff with patient rights and confidentiality. First of all, do you officially consent for the following procedure to be viewed by the rest of the audience? I promise not to expose you physically or psychologically beyond what you are comfortable with, and will stop whenever you say stop. The woman consented. Yes, I do. And could we use the word pineapple as our safe word? Because that's the word my husband and I have been using for 25 years. Excellent. And yes, of course, we shall use the word pineapple if and when you get too uncomfortable. Now, can I have your name and what are you seeking help for? My name's Jessie, and I am seeking pain relief for my back. Thank you. Have you seen anyone else while trying to find the relief you are seeking? Jessie replied, I went to a physician twice, shortly after the pain began 3 months ago, and then again a month ago after the pain persisted. She suggested I take a mix of naproxen sodium and acetaminophen until the pain dissipated the first time. And I did that, but the second time she suggested that I take a stronger opioid since the first prescription wasn't working too well. I lost my cousin to an opioid addiction a year ago, so I wasn't too keen on starting opioids if another more permanent cure could find itself. Then I heard you were coming into town, Nada, Dr. Snavely, so I've just been holding out on my naproxen sodium and acetaminophen until you got here. Zilch, damn, I am so sorry for your loss, and I totally empathize with your reasoning for avoiding the opioid routine to pain relief. So the good news is that your month of anticipation of this cure will help Zilch help you use your own brain to cure yourself. And the other good news is that you will be with your cousin again one day, in the great nothingness that comes after. Jessie sniffed back a tear. Praise be to nothing! And the crowd echoed, Praise be. One final question, and then we'll begin the procedure. What is your best hypothesis on the originating cause of this back pain? Jessie paused for a moment, formulating her suspicions into a cohesive guess. The cause may have originated from the car crash I had about 5 months ago, and it was probably exacerbated by a poor sitting posture at my stereotypical office job. Nada Dr. Snavely enthusiastically said, A solid hypothesis, Jessie. I shall concur that this is probably the cause. Although it is possible that the poor posture alone may have been enough to cause your condition, so definitely seek to correct that behavior so that the pain will stay away after Zilch heals you. Now, onto the procedure. Jessie, if you please, proceed to lay down on your stomach here on this table. Is your husband in the audience with you?
Jessie stated, "Yes, sir. Gary was sitting next to me right in the front."
Gary, is it cool if I touch your wife? I plan on giving a short massage to feel the muscles in question, followed by a hearty prayer to Zilch to allow the muscles to return to a state of equilibrium, pain-free.
Gary yelled to the stage, "Sure, just don't get pervy with the massage."
Not a Dr. Snavely enjoyed that response. Ha! Don't worry, buddy. I'll keep it PG rated.
As Jessie laid prostrate on the massage table parallel to the front of the stage, the nodded doctor folds her shirt halfway so that the skin from her lower back is exposed. He positions himself behind her from the audience's perspective so that they can see her. Proceeds to apply some massage lotion to his hands and warms the lotion slightly by rubbing his hands together.
Alright, let's determine if this is more of a nerve problem or a muscle problem. If it's an overactive nerve problem, we may need to do a more extensive treatment that will take multiple revisits to bring your back to normal. If it's a hardened muscle problem, Zilch willing, you'll be healed before you leave the building. This is a priming moment. The Nana doctor is almost certainly going to encounter a harder than normal back muscle. It is a natural response for muscles to contract in response to pain. Even though overactive nerves are likely part of the same problem, his goal is to distract Jessie by getting her mind to focus on the part of the problem he can directly interact with, so that her brain and nerves can subconsciously do the healing once the massage takes place. Alright, let's take a feel of those muscles. Wow, those lumbar muscles are tough! Geez, Jessie, no wonder you've been experiencing back pain. I'm going to have to put pressure on my thumbs to roll these puppies out. The goal of this massage will be to maximize the number of endorphins in Jessie's system and to minimize the amount of cortisol in her system. The laying on of hands adds to these endorphins, and the endorphins already regularly experienced by this source of higher power will be what ultimately pushes her brain to be maximized with feel-good chemicals. So a good healing woo peddler will not just lay on hands, they will work to touch the area of pain as thoroughly as possible. Also, it should be noted that many people do not enjoy being in front of an audience. The audience needs to aid in the helping of the individual. Otherwise, the audience will likely be a stressor. So a good healer should only pick out people who look excited at the prospect of being on stage with them. Jessie was near the front and jumped up at the prospect of being publicly healed by the Nada doctor. Since the audience clearly wasn't a factor in her desperate search for pain relief, she was an ideal candidate. Chances are there were other people in the audience who also had some back pain. If the goal is to bring healing to people, give these more reserved people the opportunity to heal in private as well, after the positive personal experience of an ideal candidate is witnessed. It is the right of patients to conceal their condition and their identity, so make time for these people as well.
After a 2 or 3 minute massage while talking about useful information about the process and proper procedures to avoid this sort of pain in the first place, now Dr. Snavely is ready to treat Jessie with nothing, which is the Placebo of Zilch. He places his hands on her back one last time, confidently and firmly, then begins to speak with an air of authoritative vigor. Father Zilch, we know that every possible thing that can causally begin to exist will exist. In thy name, may this universe hold the thing of holistic healing for your Null Jessie. May the string of causes that have led to this back pain cease in your name. May you be given the glory due to you, and may Nada be given the glory due to her, along with any infinite god of somethingness being given the glory due to them as well. Here, upon the yelling of the second saying of your name, I say unto you, bring Jessie's back to a state of pain-free equilibrium. Are you ready, Jessie? Yes, I am ready.
Zilch ZILCH! Now at this point, Jessie may feel cured. It will look convincing enough to the rest of the audience to think that she received a genuine healing from a god of nothingness. And 30% of the time, on average, she genuinely will be healed by the power contained within her own brain, thanks to the placebo effect. But 70% of the time, the endorphins will wear off, and the cortisol levels will rise again, and the back pain will return.
Zilch, damn it! Hopefully, she will return to either have continued treatments in hope of curing the nerve-based problem, get her money back, or consider the experience and the knowledge gained from that session enough to consider the money spent a donation to a worthy cause. Maybe the good advice of a healthy and more natural posture, combined with the continued use of naproxen sodium and acetaminophen, will be enough to get Jessie back to a state of normie if she is part of the 70%. And maybe Gary will learn how to give Jessie back massages more frequently. Who knows?
They went their own way, just like they should.